Welcome back to Strength Happens podcast and Happy New Year.
Yes, Happy New Year. Janine and I are excited to be back together and at it again with our fun little chats and sharing with you all. If you were able to log on to our episode earlier this month, yes, it's early in the month, but we already posted one on New Year's Day. And Janine and I talked about some of our goals for this year. And for some reason, Janine thinks I'm competitive.
I don't know.
I don't know, but we got a little competitive talking the other day and we decided to create a little competition. We have a Jill's 2026 bingo and we have a Janine's 2026 bingo for Strength Happens. And the first person to fill up either across, down, or diagonal wins a prize. We haven't really said
no,
what
we
that
didn't
prize
really
is.
discuss what was going to happen, did we?
But we will post more about this on our socials on Instagram and TikTok. And if you guys have some suggestions of what a prize could be, please let us know because I want
Mhm.
something good if I win this. I'll tell a little bit about it on here and then we'll get into today's episode. But some of the squares are for Janine and I together to accomplish for the podcast. So one of them is create 2 series for the podcast in 2026. And we're starting the first of those series today on advocacy. So once we do 2 series, we both get to check off this one off our box, but it's somewhere different on Janine's. It's somewhere else. But then there's some personal ones that we have to accomplish. One of mine is hike one mountain outside of New England. One other one of mine is fill and donate 100 sparkle bags to a local children's hospital. One of Janine's is run a race outside of her home state or talk to a marketing person on how to improve our social media for Strength Happens and the Hallie Grace Foundation. So a little fun, a little competitive, and we're getting started today with this.
Today, we're going to start a new mini series that's all about advocacy. And I want to begin by saying this. If the word advocacy already feels heavy or overwhelming, you're so not alone.
No.
Because when you're parenting, caregiving, living with a disability, navigating medical complexity, advocacy often isn't a choice. It's a necessity. And it's usually happening inside systems that weren't designed to listen to you.
Absolutely. I agree with you, Janine. We're going to talk about in this episode the term advocacy and self advocacy and what that means when we're raising kids with disabilities and chronic illness. How do we advocate for our kids? How do we advocate for our family? And advocating for ourselves as well as caregivers. And advocacy really does take on a different meaning when we talk about the term medical advocacy.
Mm-hmm.
Our form of advocacy for our kids is just a lot of responsibility. We're going to talk about that today. And it overflows from doctors' offices to school systems to our kids' friends groups to our friend groups in so many areas of our lives. Advocacy is truly our opportunity to use our voice and stand up for our child and their needs.
Mm-hmm.
Advocacy's our chance to share what we know about our kiddo and what's happening in their body because we know them better than anyone else, right? And advocacy is about asking questions, pushing for clarity, or even just speaking up when something just doesn't feel right. And I think a lot of times we underestimate, at least I did in those early years, trusting your gut instinct.
Mm-hmm.
I was like, oh no, doctors know better. But no, advocacy is listening to that gut instinct, that mama bear mentality. Advocacy is being part of the treatment plan, part of our kids' education plan,
Mm-hmm.
part of every room where decisions are being made for our kiddo's life. And advocacy for me is a true responsibility. And we're going to talk about the heaviness of that responsibility today and over the next couple parts of our series. Because at some point, we're going to realize it's not just about this moment or that appointment or this meeting. We're starting to set an example for our kids, and they're watching us
Mm-hmm.
because one day they have to speak up for themselves. And you and I are at the point now where our kids are young adults, and
Mm-hmm.
most of our kids are able to speak up for themselves, but it's not always easy. And we're going to talk about that
Yeah.
throughout this series. But we're going to talk about asking for help, how to hold boundaries, how to keep persisting even when it's uncomfortable or
Mm,
exhausting. And in
yep.
doing so, we're going to teach how they're going to one day advocate for themselves in the future. I'm very passionate about advocacy. I'm very passionate about the lived experience.
Yeah, I think the advocacy is a really key component of being a caregiver, a mom, dad, parent, anyone that's taking care of someone else. So I think it's an
100%.
important topic that we're going to.
Absolutely. I'm so glad you came up with this idea for a mini series.
Well, and I think people think it comes naturally. Some people, it may come very naturally, but for some people, it's very difficult to cross that line to become an advocate.
Absolutely. Absolutely.
And we're not just talking about being louder, and trying to talk over the doctors or talking over people. We're just talking about finding your own voice, however that voice may show up, and learning that your needs are allowed to exist. So, this is Advocacy 101. Let's
Yeah.
get into it.
Yes, absolutely.
Mm. And I think before we even begin to talk about how to teach self advocacy, we need to slow down, talk about what advocacy actually is. Because I feel like people hear the word and they immediately think loud, confrontational, and knowing exactly what to say.
Absolutely, or being that parent, right?
Oh,
I'm
yeah.
doing quotes, but it's not
Yeah.
like our podcast audience can hear my quotes. We don't wanna be perceived as that difficult parent or patient who asks too many
Mhm.
questions, but when it comes to disability in medical spaces, advocacy can be very empowering, but it can also be exhausting at the same time.
Advocacy isn't some polished skill we learned in a workshop, although that would be great. And we're hoping that just our conversations over the next couple episodes will help. But for most of
Absolutely.
us, it just came from survival.
Yes.
And we just realized that if we didn't speak up, something might be missed, or maybe they weren't seeing the full picture. And it takes time to realize you need to advocate for yourself or the others that are in your care. Can you remember the first time that you advocated for Hallie, or all of a sudden realized that caregiving and being a parent was so much more when you are dealing with medically complex children?
Yeah, I think we've had this conversation before. I was so young, I was 25 years old when I had Hallie. And I didn't know anything about raising a medically complex kiddo. And at the time, I thought
Mhm.
doctors knew everything. Kind of, I put them on a pedestal. I thought medicine was
Mhm.
black and white in that
Mhm.
situation. But the first time I really learned what advocacy was, I learned the severity of if I didn't advocate, nobody else would. And it
Mhm.
came to life and death. It came to diagnoses. When Hallie was 2 months old, she had been having some bad choking spells on the bottle. She was a preemie. She was born 5 weeks early, and she had an NG tube in the NICU. But then they said, "Oh, she's fine." And I remember being in the NICU and they gave us one more night in the NICU for us to practice bottle feeding her, and I kept going, "I think she's choking on the bottle," and they kept saying, "You're a nervous
Mm.
first-time mom. You're just anxious. She's picking up on your anxiety." So I took her home. We went and stayed with my mom, and Hallie kept having these little choking spells, and she would, feel like the milk got stuck in the back of her throat, and she'd make this gag, and it was the worst face you'd ever see, and she'd
Mhm.
choke, and I'd pat her back, and I'd sit her up, and she broke out in baby acne, and every pediatrician I took her to, I was like, something's wrong," and they're like, "No, no, you're just a nervous mom." And then when Hallie was about 8 weeks old, she had a horrific choking spell, and we couldn't clear her airway.
Mhm.
My mom was there, my sister-in-law was there, and my sister-in-law's mom, who was a nurse, was there, and my mom lived a mile from the, local rural ER, and we couldn't get 911 fast enough, so my mom and the nurse mama started driving to the ER. They got her airway cleared on the way, and long story short, she was transported to a children's hospital in Tampa, and I kept asking every specialist saw her. She had MRI, CT, X-rays, everything, blood work. And I kept saying, "Can you do a chromosome testing? Something else is wrong." And they kept telling me, "You're an anxious mom. She's just a preemie." But the swallow study did show frank aspiration. It was the food was going into her lungs, and they were right. Oh,
Mhm.
they're like, "Oh yeah, she was choking," and I'm like, "Hello, I've been telling you this. No one apologized."
Mm.
She also had pneumonia, and before we were discharged from that appointment, the neonatologist took me aside and said, I didn't think she was gonna survive when she was admitted. She was one sick baby and she's doing well, she's gonna be okay. And I'd asked every doctor, "Could you do a chromosome testing?" And they all said, "No, these are all preemie issues." And finally, I
Mm,
kept asking until someone said yes. And they said, "Fine, it's gonna come back normal, but we'll, go ahead and run it." Because I was persistent. And it came back with
mhm,
18q deletion. And no one apologized for saying I was nervous or I was an anxious mom. I knew something else was going on. My gut told me, and it was in that point that I learned I had to trust my gut.
mhm,
And from that point on, I realized this baby was my 100% responsibility, and right now she doesn't have a voice, and I had to be at the forefront of every decision, and I would not apologize for using my voice, and from that point on, I just surrounded myself with a team of professionals that respected my opinion and included me in Hallie's medical journey, and the people I trusted with the most, and who eventually included Hallie in that medical journey.
mhm.
And advocacy in these spaces isn't optional. It's not like, "Oh, I'd love to work on me facing my fear and build up my confidence."
Right.
No, it's about doing something for my child. It's about my child may not get the care they need. My child may not survive if I don't speak up.
Yeah.
And those are powerful things that we, as parents of kids with disabilities and medical issues, have to take in a different role of advocating for our child than maybe other families might.
Yeah.
Can you I'm sorry, I know that's a lot, but it's been 26 years and it's still
And
making
it's
me
still
cautious.
fresh.
Yeah.
It's probably still fresh in your mind like it happened yesterday.
I literally started getting hives talking about it because I remember that moment and how that made me feel that, "Oh my god, what if I didn't push for that?" What if because
Right.
once we got a diagnosis, we started getting early intervention, we started getting specialists on board, we started getting all these things and treatment she deserved.
Yeah, the treatment plan changes.
100%, and I was
Mhm.
the one who asked for it, and there were many times I'm the one who asked for her immune system to be tested, but for me, it's still very emotional, and I hate to do that to you, but can I ask, what did advocacy look like, or how did that take shape for you with Morgan? Do you remember that?
In a lot of ways, our journey to being strong advocates for the girls is very similar. We found our voices through experiences that made us uncomfortable, but allowed us to listen to our instincts. And
Mm,
looking back, I remember the testing and all the different specialists we were referred to once it was determined that Morgan was developmentally delayed. We were seeing so many different doctors and therapists. And I think we were told a lot of different things, but a lot of nothing.
mm,
And it was really hard to see Morgan in the same light as some of those professionals that were seeing her for only 15 minutes at a time versus what we were seeing daily. So
absolutely.
it felt at times that all they saw was this little baby girl who couldn't do. And we kept seeing what she was capable of.
Mm,
And I think the first time that I really took a stand and advocated for her was when the neurologist from previous episodes gave us her 3 diagnoses of infantile autism, visual disturbances, and muscle disorder. And we felt he couldn't see Morgan past
the
his
diagnosis.
diagnoses.
Yeah.
And we challenged him, but he was locked in and said that this is what my findings say. And I realized in that moment that I could either accept what he said, even if it made me feel uncomfortable and didn't sound or sit right with me, or I could push back and speak up. And I chose to advocate for Morgan, and we fired the neurologist, found one that aligned more with us as a family.
We had that particular neurologist at a inpatient thing, and it was
Yeah,
I agree with you.
yeah.
But
But advocacy is really about just communicating your needs, creating the boundaries with or without words.
it's about building that relationship with that
Hmm.
doctor, and how they treat you reflects on how you're gonna respond to them and how your child's gonna respond to them.
And it's developing that trust. And if you
Yes.
don't have that trust, I really don't think that you should stay with them.
Yeah, and it's okay, there's many doctors out there. You'll find the right fit for you, your child, and your child's needs. So, it's finding that right doctor.
Yep.
And sometimes for me, I don't know about you, but in advocacy, I'm think you're reminding me of those early
Mm,
years. It doesn't look pretty in the early years necessarily for me. I'm a people pleaser by nature, just
mhm.
for who I am. I don't like conflict. It's my hardest thing to face conflict. Now at my age and having to fight for my kids, I'm great at conflict. Bring it on. But in my early years when I was young and in my 20s, and I would have to talk about a doctor, my voice would quake and my
Yeah.
face would get red and blotchy, and I was nervous, but the more I did it, the better I got at it. But I remember we had a GI doctor that was not kind to me, and I went to the pediatrician at the time, and I was crying, and I'm like, "This GI said this and didn't believe me," and I told him the whole story. He said, "We're gonna admit Hallie and we're gonna fire that doctor and get a new GI." And, I said, "But I don't know how to fire a doctor." And he goes, "I help you. We deal with that together. You don't have to say
Mhm.
anything. We just have the records transferred." And, that was what I needed. Advocacy isn't always saying, "I need this," or "I want this," or
Mhm.
challenging or questioning. Sometimes it's asking for help, you
Yeah.
know? And I've always been told the pediatrician is like the captain of your ship, is what our kid's pediatrician, Dr. Tappan, always said, and he's there to help us guide, and his
Mhm.
team of professionals in his office would help us navigate with those specialists. So advocacy may also be needing a support person
Mhm.
or needing someone to just say you're not alone in this journey. And that's what having a good medical team I feel like helps with advocacy.
Yeah. And I wish we talked more about that as a society, that supported advocacy is still self advocacy
Mhm.
because needing help to communicate doesn't disappear just because someone needs help expressing it. For example, for us, when we're at doctor appointments with Morgan, she may not be able to communicate how she feels or what is going on from a medical perspective. So I need to be able to be her voice in that situation. She
Yeah.
lets me know in other ways how she's feeling. Sometimes it can be how she walks, or she'll say her neck hurts, and then I know she has a sore throat.
But you
And
know her language.
right, if you ask her what medication she's on or what medical conditions she has, she can usually tell you a good amount of them. And she can probably tell you the doctors. So she does have some ability, but just not the full ability to communicate. But that doesn't mean she's not advocating
Well, and
in
you're
her
allowed.
own way.
Absolutely, and you're giving her that space to be her own advocate in the best way
Hmm.
that she can, which I commend you. I've worked with families and you've been everything to your child for 18 years, and then
Hmm.
when it's their time to start advocating for themselves, it's hard to let go. I
Yeah.
I've been reprimanded from my kids. I remember when we go into this appointment, you need to keep your mouth shut and let me do the talking. I'm an adult now, and now I don't even go to the appointments unless
Yeah.
sometimes Neely or they'll ask me to go, but I is it makes you proud of how far they've come.
Yeah, I try not to go with the twins just because they struggled being able to advocate for themselves, and when I would go with them, they'd rely too much on me to speak for them. So I found sending them on shorter visits that go to the doctor by yourself.
Or just schedule the appointment on your own.
Yeah,
They're growing up, but yours is a little different too because Morgan, you'll be caring for her the rest of her life.
right,
So, it's
right.
gonna be different, and we'll kinda talk about that in the next future episodes of what that I was just thinking about this, if all of our kids, have
Yeah.
some realm of medical issues or complex medical care, and what I think one of the reasons advocacy can be deemed hard in the medical community is because there's a bit of a power imbalance, right,
Mhm.
between the medical system and the patient. We're in their time and in their space, so we may wait 3 hours to get in for the appointment, but then they have 30 minutes on their calendar or 15 minutes when we're there. So we're on
Mhm.
their schedule. So there's a bit of a power imbalance. But I also think there's also a power differential when we talk about school systems and
Right.
advocating for our kids because those individuals hold a level of authority. And then when you add those complex medical diagnosis or a disability, it's suddenly more questioned or it's more overwhelming. It just takes on a different realm when it comes to advocating.
No, but there's that constant underlying message of prove it.
Mm.
Prove that they're in pain. Prove that they really need this. Prove that you're giving credible information. It's exhausting that every year we have to do that and they have their records. I shouldn't have to prove every year that they had therapy last year. I need to prove that they still need therapy this year.
It's so frustrating. I see this with Neely especially, when she goes to a new doctor and has to go through her whole health history,
Yeah.
or even if she's just going in for a sick appointment, she'll wipe off her makeup because she's learned to be happy and positive because she's always sick, right, when you're immune
Mhm.
compromised, but she has to put on the presence of feeling sick and looking sick just for them to think, okay, you do have a sinus infection. It's exhausting and it's traumatizing.
Yeah, it shouldn't be, "You look good, you look fine."
Oh my gosh, I hate that. Well, you don't look sick.
Yeah.
You look normal. We've had family members just feeling dismissed sometimes or being
Mhm,
gaslit by professionals, but we do our very best to at least find the professionals that speak our language and will
mhm.
support our family as best as possible. It's always like finding the right doctors in that team is so important because I've had professionals say, "Oh, what are you, Doctor Google?" And I'm like, "No, I'm Doctor Heilman, thank you very much. I know how to do research on PubMed." No, I only throw that out if someone's being a real jerk, but I think if you're a caregiver who's been doing this a long time, you come in already tired and exhausted. And like
Mhm.
you were saying earlier, we know our kids best and we just want to get them the best care possible. We're just trying to be honest. And
Yeah,
unfortunately, there's times where we've had negative experiences in the medical community and it jades us. And
yeah.
I don't know about you, but I put up a guard sometimes when I'm with my kids. And I've been accused of Munchausen syndrome. And we took B to the pulmonologist at one hospital and they looked at me and go, "Do you even know what wheezing is?" And I was like, "Excuse me? I have 2 asthmatics at home. Yes, I know what
Yeah,
wheezing is. Every time I feed this child, they wheeze. They just happen to stop when we got to the office."
right. Of course, because that's the way it always happens.
Absolutely. And then B was super sick too, so the second time we went to another hospital, and when they were admitted, we asked to see the pulmonologist there, and that pulmonologist said, "I'm not hearing the wheeze. I believe you, but I really don't know what's going on."
Mhm.
And then we go back to the pediatrician crying, and we're like, "Dr. Tappan, no one can figure this out." And B had, virus. Dr. Tappan said, "If B keeps throwing up extensively tonight and can't hold anything down, take them to Tampa General and ask for this pulmonologist. He's my children's pulmonologist. He will get them help." So I go to the ER. I'm exhausted. My kid's been vomiting for days, is 8 months old. And I said, "Our pediatrician sent us here. We're supposed to see a pulmonologist by the name of blah, blah. Can we get them evaluated for here?" And the doctor comes back, it goes out, comes back in and says, "Now, why have you gone to 2 other hospitals for breathing issues? Why is this your 3rd? Why can't you stay with somebody?" And I was like, "Because no
Mm.
one's giving us answers, and our pediatrician sent us here." He
Yeah.
left us in the ER, even though B was admitted, left us in the ER for 7 hours
Wow.
before we got to the floor. We got to the floor at 4 AM. The nurse happened to be Miss Barber's sister.
Oh.
So we knew her from, our kids'
Mhm.
preschool teachers, and she goes, "Jill, do you know what the ER doctor wrote on your chart?" And he wrote hospital hopper. And that I
Nice.
and basically accused me of Munchausen, and I was off the handle. I said, "I want the head of pediatrics right now." So they send the chief of pediatrics. Mama Bear was a good advocate by then, and the chief resident comes in and goes, "Okay, ma'am, let's calm down. I talked to the nurse who knows you and blah,
Mhm.
blah, blah." I said, "No, I wanna talk to chief of pediatrics for the whole hospital." She goes, "Well, that's USF chief of pediatrics. He's in bed right now." I go, "I don't care. Call him." He was
Wow.
at bedside by 5:15 in the morning, and he sat there and he listened to me and why I was so upset, and he took the time and he goes, "You've obviously been through a lot with all of your children. I know Dr. Tappan, your pediatrician, he was one of my students. I know why he sent you here. We will get your child the best care possible, and I apologize." And that's where it went from being accused of hospital hopping and Munchausen to some of the best, like, leadership in the medical community, all
Mhm.
within a couple hours of each other. And
Wow.
it takes different forms, but we as families have had these powerful experiences negatively and positively, and that comes with us when we go to a pediatrician's office, when we go to a doctor's office. And it's hard. It's hard.
It is hard. I totally understand that because I feel sometimes when I go in to the doctor's office, I can feel them rolling their eyes in their mind when I try to contribute what I have researched. And as you've mentioned in previous conversations about Hallie and miscellaneous doctors, that she would often be talked about, not
Yeah.
to. And you stated how frustrated that would make her. So how are
Yes.
they supposed to learn advocacy if their voice is never the center?
Absolutely. I hadn't thought about that. God, that's so critical because how do they learn the tools if they're not being spoken to? And we're really going to talk about some of the tools for advocacy in the next episode. Because for some of us, that advocacy, as we said earlier, doesn't come easy. It didn't come easy for me, but then
Right.
that switch is triggered, that mama bear moment
Mm,
each of us have talked about comes up, and we've learned to transition into advocating and voicing our concerns or sharing what we feel like is best for our child or working with the doctor on navigating what's best.
mm,
And not everybody has it easy. It can be difficult. But I think the key with advocacy is it is a skill we can
yeah.
all learn because we don't want to come in angry and flying off the handle. We want to work with our children's medical teams, teachers, our therapists, the rehab team. We want to work and collaborate with them. We're not looking
Right.
to fight. We're just looking to give our child's medical issues a voice when they don't have their own voice.
And we have to work with these people, some of them for at least 18 years. But we need to keep these relationships open where the conversations can happen.
And for some of them, some of the medical teams that we've been a part of with our kids, those people are our family because we have collaborated with them and they've included us as part of the treatment team. And they're human, we're human, we're all part of this. We're not always perfect, but we just do the best we can and we hope they can use grace with us. They can
True. Right. Sometimes you just have to like sit back and take it all in because it can be very overwhelming. Anytime they're talking about new diagnoses at school, new therapy they want to try, or maybe they're like, well, this therapy, we're not really able to give that to you anymore, but we want to try this to help compensate for that. And I think that it's okay to take a step back and either say no or sit back and say, "You know what? I need to process this on my own schedule. I
Mhm.
need to go home, jot down things that are concerning to me, but that because I'm not good in the moment. If someone says Morgan doesn't qualify for PT anymore at school, which happened when she was in kindergarten, which is ridiculous to me.
Wow.
But anyway,
Yeah.
so they said she doesn't qualify under what we deem as PT.
Right.
I was really upset, but I didn't really know how to push the envelope and how to say, hey, that's not acceptable to us. Because I didn't know I could say that in her IEP meeting. I didn't know I could say, I don't agree with you. You need to do
Mhm.
more. So it's okay to say, I don't want to move forward with that until I can think about it. And
Process
then
it.
can we meet at a later time? And
That's a great
sometimes you just
point.
need to write it down and maybe you're not comfortable saying it to them in person. Send it in an email. Or if it's for the medical provider, go into the medical portal and say, hey, this is what I got out of the meeting and this is what I think is needs to be done or whatever. Because then that's another way for you to advocate without feeling like the pressure of having to make a decision right then and there. Or maybe you're just uncomfortable questioning them, even though it's your right. We're all human. And sometimes we're operating inside a system that doesn't slow down enough to invite the advocacy in.
I agree, and I love your idea of taking that pause because sometimes we may need to process that, and it's okay to allow that time to process a little longer before you make a decision. You don't have to make the decision on the spot, in the teacher's classroom, in the doctor's office, and that's a great point you bring up. When we're working on advocating especially in the medical community, I think the right doctors want us to ask questions, right? When
Hmm.
we have the really strong quality doctors, they open that conversation. They
Right.
welcome those questions. I would print up articles from PubMed because some of my kids had some very rare conditions. And
Hmm.
we always said if it's going to happen to a Heilman as our MO and with the pediatrician. And I would bring in PubMed articles and I'd be like, I don't know, this sounds like it, Neely, or this sounds like B, and Dr. Tappan would be like, can I see those articles? And he'd review it and he'd be like, well, this one's talking about this. So I really don't think this one's relevant, but
Hmm.
you mind if I take some time and look at these? And I was like, wow, feeling respected. So when we're
Yeah.
talking about advocacy, I have a tendency, we see the ones who aren't good with us and we learn from those bad examples, but we can
Mhm.
also learn just as much from the pediatricians or the doctors or the medical professionals or the teachers who embrace us and our advocacy as part of the treatment plan.
Right.
That makes sense? Like,
It
it
does.
shows
Because the
what.
thing is we do hyper focus a lot on the negative things that happen, and not that we don't appreciate the positives, but sometimes it's hard to bring them all together and
And we
create a
can learn
better
from both of
balance.
them. Yeah.
Right.
And I think that's kinda some of the things I've learned is with our pediatrician, he would say, "I don't always know what's going on with your kids," and I would always apologize. I'm an apologizer.
Yeah.
I'm like, "I'm sorry. We're in here a lot. I ask a ton of questions." And I would apologize in the beginning, and he's like, "Look, this is why I went into pediatrics, to help families like yours. I deal with strep throat every day with kids, but your families are the ones we really want to help as
Mhm.
pediatricians." And it just was so validating to hear that because here I am advocating for my kids, trying to ask the questions. And he's like,
Mhm.
"This is why I went into the profession to help those families." And it means something. And I guess, I'm sorry, of course, I'm getting choked up because,
Mhm. 'Cause
you
you're
know,
Jilly.
'cause I'm
Mhm.
Jilly. I'm a Lillibridge, I'm a crier. But it makes me think about what are some things we're learning from the good providers and we're learning from the not so good providers. What are some things you would want future professionals, whether that be medical students or counseling students or future educators or future rehab professionals, what are some things you would want them to know about patient caregiver and advocating?
Well, I think it's important for them to realize you're not challenging their authority and you're
Mm,
not challenging their knowledge. It's nothing about that. It's information, and they should treat it as just extra
mm.
information brought in. We've been living with these challenges and illnesses for a very long time, and we know what typically works or does not work for our kid. I just had this discussion with a doctor last week about how long do you stay on an antibiotic? And that has changed in the recent years where it used to be a 10 to 14-day cycle. Now it's down to a 7-day. And they're like, then you're off. But I know with our experience, time and time again, it's not enough. Morgan needs 14 days to truly get to the bottom of whatever the illness is, like for the antibiotic.
To get it all out of
Then
her
so and
system.
I asked them last week when we were in the urgent care, I'm like, "I know that you're doing a 5-day for the Z-Pak and the 7 days for the Augmentin. So, do I need to worry about maybe extending that?" Or and she's like, "Nope, it's 7 days." But then at that point, we have to go back to our primary because it's no
Yeah.
longer an urgent care issue. It's that whole thing is wasn't challenging her by any means, but I know Morgan and how long it typically takes.
Yeah, and you're not like you said, you're not trying to be disrespectful, you're just how her body reacts and
Yeah.
what it needs from 26 years of experience with her.
And I just want the best possible outcome from the visit. I don't wanna keep going back.
Well, and it's
Mm,
funny, not funny, haha, but ironic that that's what you bring up as an example because I just had this conversation with Neely. She saw someone before she went back to grad school. She saw someone at our primary doctor's office here in Connecticut, but it
mm,
wasn't her doctor.
mm, mm,
And she had a sinus infection and something else. So they put her on antibiotics for a 2-week supply or a 10-day supply. And I said,
mhm,
Neely, you need 21 days. Your immunologist has told you
mhm.
time after time, but she hasn't had to advocate for herself for antibiotics often. And so I had to remind her, don't forget, you need 21 day
Yeah,
supply. And we practice. How do you say
yeah,
that? My immunologist recommends a 21-day supply anytime I get an infection. So
mm,
it's really important for them to, not just us, but for them to learn those.
yeah,
And
and I think the hard part is that even being a good advocate, you don't always get what you deem necessary or what you want,
that
unfortunately,
that's so true. And
but at least you
sometimes.
tried.
Yeah, and sometimes it comes back where she's gonna get sick again, and it's unfortunate. This doctor was kind enough, and so the doctor's like, "Okay, try this and this. If by tomorrow it doesn't alleviate some pressure, I'll put you on steroids." So that was nice
Yeah,
that they offered an alternative. But I love that you said we're not trying to, like, over challenge them or put them in a different place. We're just giving advocacy is all about data, it's context, it's
Hmm.
those lived experiences that you can't learn everything from the textbook. It's the stories, the feedback,
Yeah.
this open door communication with the family. But if you don't take the time to listen, this is when someone may shut down and we
Yeah.
may not get the best possible care. And we know sometimes too, when people advocate, they're at their most emotional state. It's usually because their
Hmm.
child's sick or they're facing a medical challenge or something's going on and they can't get an answer from it. It's
And
just
they're scared.
yeah, they're scared. It's just trying to communicate under stress. So teaching advocacy really is about helping them with safety, with confidence, so many things that we can help them with that.
And I think sometimes just breaking it down to them to saying, I need help
Yeah.
and I'm not getting what I need. And I'm coming to you to get what we need. And maybe putting it back into their hands, maybe that helps with the advocating as well. Oh.
And we're going to be talking about a lot of things about advocacy and how to teach advocacy. And as we do, I just want us to hold on to one thing. Advocacy is not about being perfect. It's just being about feeling supported and being supported. And finding your voice doesn't mean finding the right words necessarily, but sometimes it just means finding the right people to put in your life, the right professionals to surround yourself and your child with. It's about finding the right people. And I found the right people with Janine. You've been
Yeah.
someone who's been a good advocate with me and that support system that my family needs.
Well, I feel the same way. I feel like we both help each other in other ways. So, where you might not be as strong, I'll give you a different perspective. And the same thing goes the other way. So, as we're wrapping up today, I want to pause here for a moment. We've spent this episode really unpacking what advocacy actually looks like, not the idolized version, but the real lived version inside disability, caregiving, and medical spaces.
And if there's one thing we hope that you take away, it's that advocacy isn't a one size fits all. It doesn't have to be loud, it doesn't have to be perfect, and it certainly doesn't have to be done alone.
We've talked about advocacy as awareness, as communication, and as supported voice, and as something that can show up through words, devices, behavior, or even a caregiver stepping in. And for a lot of people listening, just recognizing that might already feel like a shift.
Now that we've laid out this foundation, now that we've talked about advocacy and why it can seem hard, in our next episode in the advocacy series, we're going to start getting into the more practical things associated with advocacy.
We're going to talk about teaching self advocacy and finding your voice in ways that are realistic, supportive, and safe. We'll share what that looks like at different ages, abilities, and different stages, and how advocacy can be taught without pushing independence before someone is ready.
Absolutely. Because finding your voice isn't about forcing confidence, it's about building capacity and permission and just offering that safe space over time for individuals to explore what advocacy looks like for them.
So, as you head into the rest of your day, we just want to leave you with this. If advocacy feels hard, it's not because you're doing it wrong. It's because you're navigating systems that weren't built with your reality in mind. Your
Mm.
voice matters, even when it's quiet, needs support, even when it shows up imperfectly.
And thank you all for being here today, for listening, and for the advocacy. You're already doing it. But whether you call it advocacy or not, we're proud of you. We'll see you next time as we continue this conversation on teaching self advocacy and finding our voice. This is Strength Happens.